Welcome everyone to today's webinar. Patients expect a better technology experience. Here's how to meet their new expectations in surgery centers and orthopedics. I'm Brian Zimmerman on behalf of Becker's Healthcare. Thank you for joining us. So before we begin, I'm going to walk through a few quick housekeeping instructions. So we'll begin today's webinar with a panel discussion, and then we'll have time at the end for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you don't see your panelists or the slides moving, or you have trouble with the audio, please try refreshing your browser. You can also submit any technical questions into the Q&A box. We have folks on the line who are happy to help. So with that, I'm going to dive right into the discussion, and I'll have our panelists introduce themselves as they tackle this first question here. So just to begin, I'm curious if we can talk about how each of your practices or organizations were impacted by COVID throughout 2020. Tim, I'm going to give you the honor of kicking things off for us.
Thank you. Good morning, everyone. My name is Tim Spooner. I'm President and CEO of Spooner Physical Therapy in Phoenix, Arizona. We operate 22 outpatient physical therapy and occupational centers around the valley. How we were impacted is pretty similar, I think you're going to hear, to others, in that we lost 40 to 45% of our volume immediately and then began that slow climb back out of it. In addition, with that, we had to lay off some folks because of we didn't have the volume. And from there, we had to address how we were going to interact with our patients who still needed our services. Pain didn't go away during COVID. So we need to find out a way to interact with them. So that took on, I think there'll be several other questions into this, but there are many ways that we interacted to stay connected with our clients so that we could serve them.
So, some serious challenges there, and then also some transformation, some change management there to reach those patients. Appreciate you being here, Tim. Joe, I'm going to turn it to you next. Same question. How was your practice impacted on COVID? And go ahead and introduce yourself for our audience.
Sure. Thanks, Brian. I'm Joe Mitchell. I'm the Director of Finance with Colorado Pain Care. We are an interventional and multimodal pain management company that has 3 clinic locations, 2 physical therapy clinics, as well as 2 ambulatory surgery centers. And I think the real question here is, how did COVID not impact our practice? Because, it's such a tumultuous time, throughout our industry. And, for better or for worse, I think a lot of positive changes came out of it. But really, our practice in particular, we certainly saw a decrease in our physical therapy appointments. And I think the real pinch point that we experienced was a 33% reduction on average in the 3 months following the outbreak of the pandemic to our new patient volume. So fortunately, I think that we were pretty nimble and we were able to kind of course correct and mitigate and try to turn things around pretty quickly.
Well, thank you, Joe. Yes, similar notes to Tim there, and I imagine we'll hear more similar things about how to be nimble and change and get to those patients. Nick, you want to go next here?
Absolutely. Good afternoon, everyone. I'm Nick Bora, CFO of Pain Specialists of America. We have pain clinics in the Central Texas area with Austin as our primary locations, and we have a couple of surgery centers as well. COVID-19 definitely had a detrimental effect on volumes initially, as well as our ability to provide quality patient care. Our medical practice caters to patients with chronic pain, and Texas Medical Board, as an example, previously did not allow telemedicine. And so we had to figure out, in addition to dealing with how do we see our patients, how do we provide them care, and how do we take care of them while we're not able to physically see them during lockdown.
Thank you, Nick. Yes, certainly a major challenge there. Cindy, turning to you now.
Hi, I'm Cindy Murray. I'm the Chief Operating Officer at Orthotexas Physicians and Surgeons. We're a large orthopedic and sports medicine group in North Texas. And I would agree with Joe. There was really, the question is, how did it not change our practice, or how did it not impact us? You know, everything that we knew about our business and also our lives completely changed. We literally had to pivot within about 48 hours and make some changes to our practice that we never anticipated. You know, telemedicine being the primary way to communicate with patients was one example. We had to cross-train staff. We had to deploy a large percentage of our staff to home. And these were things that we never anticipated or never saw in the practice's future prior to March of 2020. So it changed our practice all the way from marketing strategies to operations to, you know, the physicians' schedules and lives.
Absolutely. Thank you for being here, Cindy. Tamara, you want to go next?
Absolutely. Good afternoon, everyone. I'm Tamara Porfirio, and I'm the Chief Operating Officer for Weil Foot and Ankle Institute. We are a 30-site medical practice located. Our headquarters is in Mount Prospect, Illinois, and our 30 locations are off over a 5-state area. Like everyone, COVID was a challenge for us. We had a corporate headquarters based in Mount Prospect, where at the time we housed all of our business and corporate operations. So as soon as COVID was starting to enter the U.S., we moved all of our non-clinical team members off-site. With having them all in one location, an outbreak at that location could have crippled us and our operations. If it took out, we had an outbreak in our call center, for instance, all of our communications would have taken a great hit. So we started with a team of 25 from various departments initially, and then moved everyone off-site within a couple-week period. It was a unique and heavy lift for our IT team, with having to secure all of the hardware and equipment necessary, webcams, headsets, PCs, etc. But it was a unique situation for us because as a company that's growing more nationally, the changes we made during COVID helped impact our ability to manage teams over different geographies and uniquely prepare us for our growth. And on the patient side, a couple of things that we did is, one, we implemented a remote check-in and registration process for patients. Before COVID, patients had to complete registration at our electronic kiosks. We expanded this to patients being able to check in from home or complete their registration paperwork from home, from their smartphone or from a computer. And then we implemented contactless check-in. So patients could let us know when they arrived through their smartphone, and then they can wait in their car. So we essentially established a virtual waiting room. So patients could ping us when we arrived, and when their exam room was open and available, we would ping them back to have them come in. We also implemented online or text to pay and a quick pay item on our website so that patients didn't have to log into a portal, which a lot of them, quite frankly, didn't take the time to do. But by accessing quick pay and text to pay, we really improved our revenue capture by adding those features.
Thank you for laying that out, Tamara. I think, the employee side of this can't be overstated of trying to manage all that. I imagine that was a significant challenge as well. And I think you've all sort of laid out all the many, many ways that COVID disrupted the healthcare industry and surgery centers and orthopedics. So appreciate you all being here. Brian, I'm going to throw it to you now to round things off with our introductions.
Thank you very much. Thanks, everyone, for joining. On behalf of Rectangle Health, I want to thank the panelists for joining this amazing webinar. My name is Brian Doyle. I'm the Vice President at Rectangle Health. Rectangle Health is a healthcare-centric patient payment and engagement solutions company. To piggyback on what everyone just said, there was a drastic shift of virtual medicine, of centralization, of contactless and frictionless, not only engagement, but payments as well. We still had to make sure the organizations were collecting and getting paid. So Rectangle Health, we deployed, and our biggest challenge was how do we deploy our software to A, our book of business immediately in March of last year, and then B, make it scalable for all new business going forward. So we really centered on the patient experience, making it contactless. Tamara just touched on a few things that, have been massively successful, and the adoption rate is very high. And that's things like digital registration and text to pay, and quick payments via our cell phones. We're all on our cell phones quite often. So making it as streamlined and straightforward and adoptable on the patient side was our biggest challenge that we faced. And it was COVID. There was a lot of negatives, obviously, but COVID has brought technology to the forefront. And that's very exciting as a technology vendor on Rectangle Health. We see that as something that was needed in the market and then has established itself as commonplace in today's healthcare environment.
Thank you so much, Brian. Yeah, the comments from you and Tamara, I think, really bring me to the next question, which I think folks sort of either mentioned specifically or alluded to, of having to reach these patients where they are beyond sort of the physical in person. So the question then is, what new patient demands or requests spurred as a result of the pandemic? And I'd like to start with Tim on this one, to loop back to you, if you could drill down a bit and address this question.
Yeah, great question. And the key we had was to meet the patient where they were at. If that was at home, we had to spin up a telehealth option for them. If that was in the clinic, we had to communicate with our team members and keep them safe, but also with the patient to let them know that we were abreast of all the guidelines out and that we were keeping the environment safe. We had 0 transmissions from patient to employee or from employee to patient during this whole course. And that I think was an amazing aspect of our COVID task force that just kept us abreast of all the different things, and we spaced things out. We did what was prudent and safe while maintaining a fairly heavy volume the entire time. Because once we dropped our volume, that became, it started to come back rather quickly over the next couple of months. The other thing is just, and it's been alluded to here, some contactless ways to interact. Needless paperwork could be avoided or done ahead of time. Payment modulations and different methods could be streamlined. Those were key. And again, we just tried to keep that patient at the center of what we're doing, and patient safety and employee safety at the center of it, and what was best for them as we continued to digitize a lot of our different things. In addition, when we dropped we had an outside sales team, which is one of the casualties of our layoffs. Immediately right after that, we spun up an internal digital team, and they were able to connect us with our audiences through social media, through our website, through different ways of connecting with our patients and community and referral sources in new and really high-touch ways that we had not done before. And that was a real key to our success.
Thank you. Yeah, you're really human-centric when you were thinking about you leveraging this digital technology in a way that keeps the patient's actual needs at heart, and the staff as well. So appreciate those comments. Joe, I'm going to turn to you next. Same question. What new patient demands or requests came as a result of the pandemic?
Yeah, despite the fact that there is this pandemic, and despite the fact that there are all these new guidelines coming out of Washington telling us what we could or could not do, Tim already kind of mentioned this, but chronic pain just doesn't go away, right? And it's kind of implicit in the term chronic pain. It's not temporary, it's not fleeting, and it's not conditional. So trying to kind of solve for that and trying to treat patients while we're all, dealing with all these new guidelines, was, paramount. And the way that we were able to kind of solve for that was by leveraging new technology in a lot of the ways that some of the others have mentioned. I mentioned in my previous answer that the real pinch point that we felt was in our new patient intake and new patient volumes. And I don't really care who you are, if you're in the healthcare space and you're a private practice, if you're not effectively managing your new patient intake, you're going to die in the vine. And so, we realized that we had to kind of quickly solve for that. And we did that through digital registration, digital intake, trying to make the process as simple and effortless as possible for not only our patients, but also, our referring provider community. So, we did that. And then the other thing that we did that really helped, I believe, was also the digital check-in. So giving those patients the option of being able to wait in their car rather than, our lobby, and just decreasing those face-to-face interactions, not only help to ensure patient safety, but staff safety as well.
Thank you so much, Joe. I really, that virtual waiting room, right, is a big piece of this. And Nick, turning to you now then for the same question, what new patient demands emerged, and how did you go about addressing those?
So from our perspective, we, echoing Joe and Tim earlier, we did a lot of the similar things from, easing how a patient was seen over telemedicine. And telemedicine was not allowed in Texas prior to COVID. And so we really had to spin up various platforms to see what worked best for patients as well as physicians, and educating the staff. So, similar things as echoed by Joe, we kind of had to do similar things to ensure that patients had to be seen, chronic pain doesn't go away. And so how do we meet the patients where they are?
Right. Thank you so much, Nick. And Cindy, being in Texas as well, does that experience ring true to you too?
It does. I think the one thing that we really experienced was the patients really needed to feel safe and secure as well as connected to the practice. So we looked at different ways. Obviously, telemedicine was one way that we stayed connected with them. Even phone calls, if the patient wasn't able to connect via a video, a lot of our physicians as well as physical and occupational therapists spend a lot of time just calling the patients, checking on them, making sure they didn't need anything, see if they wanted to schedule a telemedicine visit. The other thing that we saw was patients, wanted to make sure that it was safe for them to come in should they need to be seen in person. So we did a lot of on-demand messaging, just letting patients know, one, we're open, and two, it is safe to come in. We made sure that they were aware of all of our new policies and procedures that we had implemented related to keeping them safe, as well as keeping our staff safe. I'm also proud to say we had no in-office exposure, so I think that we did a great job with our policies and making sure that everybody was safe to come in. We spent a lot of time updating our website in addition to those on-demand messages, just telling patients what our policies were related to the pandemic and making sure that they stayed informed of those policies. And I think, again, just keeping in contact with them was a demand that we saw, as well as making sure that we reassured them that it was safe to come into our offices or we could take care of their needs from their house.
Definitely. Thank you so much, Cindy. And Tamara, I want to move to the next question with you. You laid out a lot of sort of the technology implementation that took place that your organization did during the pandemic. I'm wondering if you can drill down and tell us a little bit of how you prioritize this technology implementation and what the whole process of rolling that all out looked like. Can you kick us off on this next piece?
Sure. So when we started to implement, we were doing a lot all at once. And it was, for us, we decided to take a step back and prioritize according to the patient life cycle. So we started with moving off our call center operations to remote, where they could operate safely and keep in close communication with our patients because things were changing daily. Then we moved to implementing our spinning up telehealth. It was not something that we offered widely before COVID. Once we spun up telehealth, then we moved to the contactless check-in. So we kind of, gave our patients an option to communicate, then to be seen virtually if they wanted to. But so many of our patients still wanted to come into the office. So some of them were more comfortable waiting socially distanced in a reception area. Others were looking for different options. So that's when we created our virtual waiting room out in the parking lot. We implemented contactless check-in. And then lastly, thinking about the patient options for revenue collection, that's when we implemented our quick pay on our website and also our text to pay. So we kind of prioritized based on the patient life cycle.
That makes a lot of sense. And really by doing that, you're able to address different patient needs, different patient desires of who wants what, to really tailor it almost, right?
Yes, absolutely.
Excellent. Brian, I want to turn to you now and talk a bit about what you've seen here from your perspective about how you've seen folks prioritize technology implementation, and even back to the last question, if you want to weigh in there too, about what new patient demands you've seen.
Yeah, absolutely. So the panelists touched on a lot of it, but the first thing we saw straight out of the gate was the need for digital registration, digital engagement, just engagement in general. The thought of walking into a provider's office, sitting down with other people, especially a year ago or 18 months ago, having a clipboard, handing over a credit card, going through that whole process, that just became, it can't happen anymore, right? It just stopped all of a sudden. So how do we fix that? Well, we had to take forms and push them out via text, for instance. You're on the train to your appointment, you get a text, you check in right then and there. Taking that a step further, though, we also started seeing virtual medicine explode. So we had to get things like card on file in place. We had to get subscriptions or recurring payments. You hear this a lot, but it's care now, pay later type of structures, mainly because patients needed more flexible options during COVID and really up until this day, where, again, us as consumers in retail, the retail world, we're going on the website and buying something. We have all these options. Those options were brought to the forefront in healthcare, and it really sped up the process. Traditionally, healthcare is behind retail and payment and engagement technology. It's just fact of life. COVID brought all of that to the forefront. We saw amazing providers like the panelists on this webinar make the changes very quickly, and they are one step ahead of the providers that didn't. So the things we really saw immediately were the need for engagement, the need for digital registration, the need for card on file was very important. And then, of course, the text to pay, the online bill pay options. And then what we're seeing even more today as we're getting further and further into this new normal, as everyone likes to say, is e-statements. Everything's digital now. We don't want paper statements in the mail. We don't want to have to call in or write a check or do any of that other kind of minutia that comes with collecting money from patients. We want e-statements. We want card on file. We want a click here to pay button text to me with post adjudication. That's everything that is coming up and being deployed in the industry right now.
Yeah, and fascinating comments too about the consumerism in retail or other industries where that sort of is, even that was accelerated by the pandemic, right? Like more than ever, we're relying on same day deliveries or grocery shopping through these convenient technologies. So it's just become almost table stakes, right, at this point.
Yeah, it's absolutely commonplace today. When you think about what we do in our day-to-day life, it's all contactless. Groceries is a great example. If you told me 3 years ago I'd be ordering my groceries on my phone, I probably wouldn't have believed you, but today it's just commonplace. So that's a great point.
Absolutely. Thank you, Brian. Cindy, I want to come back to you on this question too. If you can talk a little bit about how your organization prioritized technology implementation and what those processes look like.
Well, honestly, we didn't have time to prioritize. We just jumped right in within about 24 to 48 hours. But I would say the priority for us was telemedicine right at the beginning. We were live with that within about 24 to 48 hours. Once we got that taken care of and we knew that we could stay connected to our patients in that way, then my next step was to look for one system that basically covered multiple areas for us. And as far as those patient demands, that we were seeing and anticipating, what we could implement to take care of all of those demands. And one system that did that for us was online scheduling. That was a big benefit to our practice. It also enabled us to reduce our volume in the call center as far as our call center agents, because like most people in the industry, we were seeing staffing shortages related to people needing to stay home, help their kids, with homeschooling, and weren't able to come back into the office when we did bring the staff back. So the system also that we looked at, in addition to online scheduling, the on-demand messaging that I spoke about earlier, so we could stay connected to the patients. Also, customize appointment reminders were now something that we had access to. And that was real important because those policies and procedures were changing almost daily or weekly at times. So we were able to customize those appointment reminders, telling patients what to expect when they came in. And also the system provided for electronic registration as well. So like everybody else, all the other panelists, we saw the need to have that contactless registration process.
Absolutely. Thank you for laying that out. That contactless is such a big piece of this. Nick, I want to turn to you as well and see if you can dig in here a little bit and talk about how you prioritized it. Did you jump in like Cindy? How did you manage all this?
Yeah, we definitely had to, focus on telemedicine as a start and looking at several platforms to see what would work best, keeping HIPAA compliance and privacy in mind, and as well as, having a lot of Medicare patients, ease of use and, and then like everybody has talked about, the contactless payments, check-in, educating the front office staff, of setting up the call before the physician actually came on. Another area that we really had to focus on was, as things started opening back up, is how did you provide patients the peace of mind that we were a safe practice? And so one of the things we ended up doing that was very, very useful was video-related marketing of our physicians in their offices, and so people could have a visual of what a process would be like as they came to our practice once lockdowns ended. And, we're an interventional pain practice, and so telemedicine is difficult, and a lot of our procedures, surgeries, it was hard to do over the phone. And so it was critical for our patients to feel safe to come in. And so, videos of our physicians, how the clinics operated, went a long way in giving patients comfort while giving them the ability as well to do follow-ups via telemedicine.
Yeah, I imagine that the video component of this was pretty powerful, right? It's one thing to send to deliver a message that it's okay to come back. It's another thing to let them see the facility and see the doctors at work, right?
Right.
Exactly. Great. Nick, same question, same statement here to you. Wondering if you can give us a little bit more information here, Joe, about how you're prioritize the technology implementation.
Yeah, absolutely. And much like Cindy in her practice, there wasn't a lot of time for reflection or sitting down and kind of going over how we're going to be prioritizing these issues. So I think the way that we did it was we always had kind of one constant focus that we would revert back to, and that was really patient safety. Not just patient safety, but patient and employee safety. And so, as I've already mentioned, as a few others have mentioned, really trying to limit face-to-face interactions between patients and staff. And so, did that through a lot of the conventional methods that a lot of other panelists have mentioned, like telehealth visits and, digital waiting rooms and virtual waiting rooms and, electronic registration. The other thing that we really had to tackle was our urine drug screen labs. Telehealth is a great tool. Nick did mention that in interventional pain management, it does have its challenges, especially with, procuring those labs and ensuring patient safety. We really had to get creative and try to solve for a way that patients could come in and still, have their telehealth visits, but still find a way that we could get those lab results back. So doing that just to ensure that, not only are we limiting the face-to-face interactions and potential exposure to COVID-19, but also in that we're making sure that patients are adhering to our safety protocols. That was paramount to us. But for the most part, it was very tumultuous times, and just kind of having that one guideline of just, hey, is this in the best interest of our patients and employees? That was always kind of our mindset.
Yeah, having that North Star amid a pretty tumultuous time, I'm sure, was very important in staying focused. So appreciate that, Joe. Tim, before we move to the next question, I want to give you an opportunity to dig on this piece as well and talk a bit about what your technology implementation process looked like.
Yeah, much like everyone else, with our internal digital team, marketing team, that became a very key thing for us to communicate with our patients. And we had our database already set up so we could communicate with them on regular basis of what safety things we were doing, also what they could expect coming into the practice. But bottom line is that, regardless of what was going on out in the environment, there were people on both sides of the political aisle. There were people on both sides of, whatever issue you wanted to put out there. But people needed health care, and they needed a primary care MSD specialist. And that's what we are. And so they sought us out. And so we just found different ways to connect with them, whether it was via their phone because they were on their phone watching the news all the time, or if that was if they were at a computer, we could find ways to connect with them. And that's really what we sought out to do. And, a lot of times we were just explaining to them saying, look, we may think we're in the first pandemic we've been in, but we've been in a pandemic for the last 15 years. And they'd kind of scratch their head and look at you and you go, has anybody heard of the opioid crisis? I mean, we've been in a major MSD issue for a long time. We have several chronic pain specialists on the call that they've been dealing with this downstream effect of opioids for a long time, and it's a challenge. So the moving upstream for us was just a natural part of the disruption that COVID brought. So for us, COVID was a great thing.
Yeah, and you're kind of talking about being able to be like the signal through the noise, right? Being like, hey, we're here, and we're here to take care of you. For just making that very clear to your patients, regardless of what's happening outside.
Correct.
Excellent. So I want to move to the next question here, and Brian, I'm going to ask you to get us going on it. But I want everyone to be able to talk about we talked about all this change. I want to talk about staff and patient adoption of all these new technologies and any lessons learned here, challenges encountered. Brian, from your perspective, what have you seen?
Yeah, this is the most interesting piece of the whole equation to me on our side is this technology, everything we're talking about, it's not new. We've had card on file for years, literally 20, 30 years. We've had engagement tools, we've had texting, but the overall theme was our patients aren't going to do it, or we can't have that, or whatever it might be. But we've seen the polar opposite. We've seen a massive increase in patient adoption. I'll just throw some numbers out there real quick. 57% of the patients we surveyed said they want to fill out forms digitally, and I actually think that's a little light. I think it's well north of that. 59% they want to pay via some type of text or email. Like Tim just mentioned, we're on our phones all the time. Paying on our phone is substantially easier, especially when you have Apple Pay on there, you have your card stored. You just click one button and you're moving on. It streamlines the entire experience for not only the patient, but the staff as well. Think about the billing office workflow of the old way of doing it, which is sending out paper statements, calling, chasing down the patient, et cetera. That all gets streamlined by technology. And then the last one that we've seen a very large increase of recently is this care now, pay later, or payment plan, installment plan, wellness plan, whatever you want to call it, where I might owe $1,000, but hey, can I do $250 over the next couple months, 4 months, or whatever it might be? We've seen a 60% patient adoption rate to those types of payments. So patient adoption is skyrocketing. I think it's only going to get stronger as these technologies become more and more commonplace in the industry. So I do see patient adoption not being an issue for this technology. And then on that final note on that is this technology is relatively easy to implement. There's a lot of great vendors out there. Obviously, I think Rectangle Health is one of them, but there's a lot of great vendors out there that can get these technologies up and running for your organizations relatively painless.
Thank you, Brian. Yeah, I think that's an important and fascinating point, thinking about the ease of adoption with the technology, but also the payment plans, and perhaps about maybe with the widespread adoption of the technology, the payment plans that healthcare has needed for a while, it's sort of the perfect moment to implement those because the technology allows more convenience, right?
Yeah, absolutely correct. Absolutely correct.
Tamara, I want to turn to you now on the same question to talk about how either staff or patient adoption of new technologies played out for you, and any lessons learned there.
Sure. I'll focus on our staff because we did take a large portion of our workforce and move them to remote operations. So it was very new for our leaders to now lead in a virtual remote world, and also for our staff to learn how to function in some ways independently. There wasn't a resource sitting to the right or left of them all day long. So we implemented a lot of different ways of communicating to keep people engaged. Each department, we created chat rooms so that they could throw questions out there and have team members or leaders answer their questions remotely. That's worked really well in our contact center. We have implemented an internal community, social community, so people can post internally and share stories about their, families or exciting things going on in their life, because it was a way to keep people engaged. They were used to being able to, chat with each other, getting coffee or at the water cooler, and now we had to take all of that virtual. So it's really, I think, forced us to think and manage differently, but it's been a good change, I think, for us. Remote work was a little bit taboo in a lot of industries before COVID, and I think we've proved that we can be very successful, still hit and meet, and in many ways exceed our key performance indicators, and giving many of our team members who are non-patient facing a different work-life balance, taking away their daily commute and replacing it with family time. So that's helped a lot for us.
Yeah, I really love those comments around thinking about how do you replicate some of those, the maybe learning by osmosis or just camaraderie that you get when you're in a shared office space. How do you replicate that with technology? So some fascinating stuff there. Thank you, Tamara. Cindy, I want to turn to you next on this same question.
Sure. I think the most important lesson that we learned is that change is actually possible. And our staff and our physicians, as well as our patients, underwent many, many changes. And you know what? We came out ahead and we came out okay. So we did learn that it is possible. I think in hindsight, it's always important to cross-train employees for any organization. And, everybody gets busy and they just focus on their day-to-day tasks, and they forget that cross-training needs to be done. So that was something we really had to do in a hurry. And, as we tried to cover the limited schedules that we had, and we really should have implemented that much, much sooner prior to the pandemic. I think the other area that was a challenge that in hindsight, would have gone more smoothly if we had always focused more on just simple IT training. When we had to deploy everybody or most everybody to work from home, we really never anticipated how much trouble some of the employees would have just doing something simple as logging in remotely. So again, additional IT training would have accelerated that process and made that a little bit quicker and more simple for us.
Yeah, I mean, I think we all can maybe relate to how surprising some of the transition to a digital life how little hiccups can happen there. I appreciate that, Cindy. Nick, turning to you now, can you talk about any challenges that came up or any lessons learned?
Absolutely. I think a couple of things that jump to mind. Definitely, as we went through the months after we started seeing patients in person and our clinics were open, we were doing everything in a safe way, but I think we could have probably done better related to communication with our staff, especially in their off time, how they went about, dealing with the pandemic. We could have probably done a little bit more to help. But at the same time, the challenges were that sometimes, staff can catch COVID or be positive and come back and not know it. So I think we could have done a little bit better from a testing standpoint to have better processes in place so that, we could keep the clinics going as usual. We didn't have that much impact, but that is something we've looked back and that we could definitely do better. Another thing that was a challenge at being an interventional pain practice is how do the physicians, especially over telemedicine, without examining the patient's order procedures or surgeries that a patient might need. So some of our physicians have really, developed algorithms where depending on what they are able to evaluate, they feel more comfortable going down an established path and getting a patient to a procedure. So definitely some positive changes from it and some things as administrative staff we could do better. Another thing that, we were a quasi-remote company to begin with pre-COVID. And so for us, the transition to remote was not as challenging or difficult. But one thing we realized with everybody remote, we needed better productivity measuring tools in place that could help ensure that, the work was getting done, whether it was a biller or a call center personnel that were working from home and answering phone calls. So definitely all that we have learned has led to positive changes for sure.
Right. And I imagine in such a hard situation, it's impossible not to have some mistakes and lessons learned. So I appreciate you sharing that, Nick. I want to leave time for audience questions at the end. So I'm going to push to the next question, and I'm going to start with you, Joe, and then Tim next. So you can weigh in on anything you have to share on this piece too, as far as lessons learned. But I also just want to ask this final question and give everyone a chance to weigh in on it. Is your practice more prepared, eager to implement technology? And was COVID transformational for your business? I think I know the short answer to the last part of that question, but I want to give everyone a chance to speak to this. Joe, we can begin with you.
Yeah, thanks, Brian. COVID was absolutely transformational for our business. And, I think that we were already pretty eager to implement new technologies to begin with before COVID took place. But COVID was definitely transformational in the sense that, when we made all these switches to electronic patient referrals and intake and virtual waiting rooms, we kind of acted as a guinea pig for the particular vendor that we used for that. And, I saw amazing results from it, and proud to say that, I think a lot of other practices are kind of leveraging the software because of our contribution to it. So, yeah, absolutely eager to implement new technologies. And I think that that's really important in this industry, is kind of staying ahead of the curve there. We're looking at a couple different things right now with AI and robotics. And so absolutely, yes, technology is key.
Excellent. Thank you, Joe. And thanks for all your insights today. Tim, throwing it to you now for this last question.
Yeah, the answer is certainly yes, right? It was certainly transformational. And, we're very big on in our delivery of relying on how our culture is internally. And our culture is everything of how we take care of people, how we take care of each other, and how we take care of our communities. And in order to implement that, we need to communicate. And so for us, we brought in teams right away to have set up different channels where people could communicate across the company, and whether it was educational things, whether it was information sharing, whether it was just getting people to know other people within the company so that they felt more connected. You know, one of the biggest detriments, and we'll be measuring, I think, this for years to come, is the effects of the isolation on our communities. We heard it from our patients. We heard it from our employees. I think it was Nick who was just talking about that. And, you know, that's a huge thing to be able to provide support for people in an already fragmented society. When they were isolated, it certainly brought out a lot of their fears. So we used a lot of different tools and got comfortable with them in terms of how to communicate with each other across them. And it was instrumental for us when we couldn't be in the same room with each other. I think everyone's kind of said this, but COVID is transformational for the healthcare industry, and we should be the leaders on this in terms of making sure that we meet our patients and our clients where they're at.
Thank you for that, Tim, and thanks for being here. Tamara, I'm going to throw it to you next for this final question. Anything to weigh in on here?
Sure. I think, COVID was transformational for us. It forced us to become and be more nimble, which is great. I think that we've come together as a team really well. Innovation is one of our core values, and we pride ourselves on it. And I think that we are definitely open to and have been adapting tech faster than we would have normally done. And some of that was, required, really, given the circumstances. But I think it's transformed the way we look at things and how fast we're moving on different initiatives.
Thank you, Tamara. Appreciate that. Cindy, throwing it to you for final comments on this question.
It was definitely transformational for our business. We made a lot of decisions and implemented new technology that honestly would have been met with more resistance from both the physicians and the staff if we had not been forced to look at improving our efficiencies and also reducing our expenses during the pandemic. And, luckily all of those implementations went well. So I think that everybody is more open-minded in the future. I also think that they realize the importance of staying ahead with technology and not waiting until you're forced to implement something literally overnight. So it is important to stay ahead in the industry.
Thank you, Cindy. Nick, turning to you now.
Yeah, absolutely. COVID, I'm going to change the question since COVID is not over yet. It is transformational, and it keeps us on our toes, and we still have to make tough decisions from an overall standpoint of keeping up with, I hate bringing up vaccinations, but that's the next frontier of trying to figure out, how do we get everyone comfortable so that everyone is safer, not only for employees, but patients as well and physicians as well. So it's definitely challenging, and it keeps transforming how we operate.
Definitely. Yeah, it's an important point, Nick. It continues to be transformational, right? Thank you so much for that. Brian, I want to turn to you now for final thoughts before we get to some audience questions.
Yeah, absolutely. I think everyone's going to know my answer. Yes, technology is absolutely necessary today and going forward. We get asked a lot, well, how much longer do you think these technologies are going to be trendy or whatever it might be? And my answer is they're not trendy. They're necessary with today's consumer changing. The consumers today that go to healthcare grew up with iPhones, grew up with these technologies. They're going to use them as they go through their healthcare and just life journey. So yes, technology is absolutely necessary, and it is here to stay. And these technologies are readily available for any organization.
Thank you so much, Brian. Thank you to Cindy, Joe, Nick, Tamara, and Tim. It's been a great discussion. It's been a real pleasure listening and engaging with you all today. And we're now going to begin today's question and answer session. So as a reminder to attendees, you can submit those questions by typing them into the Q&A chat box on your webinar console. Let's dive right in here. So the first question I'm going to send out there is addressed to Tamara. So can you talk more about the text-to-pay solution and how easy it was to implement?
Sure. So for us, we opted to partner with a third party who was focused on our patient responsible balances. And we did this as a bridge to us moving to a new EHR platform. So a month from now, we're moving to a new EHR platform that has text-to-pay included in it, but we wanted that feature during COVID. So for us, it was very easy. Honestly, we moved to this third party. They were able to come in and immediately push out text-to-pay options. They helped us with that quick pay option on our website as well. So we were able to get it up and running in just a couple of weeks. And our patients have adopted it really well, especially the younger population. It's just convenient. When they get that text, if they have a couple minutes, they're able to just pay it right there. And it has improved our patient collections on patient balances collected outside of a patient-facing situation pretty significantly.
Thank you for sharing that, Tamara. I appreciate it. The next question I'll jump to, I believe this speaks to some points that several of you talked about, which is the attendee asked, can you elaborate on the contactless check-in and virtual waiting room? How does that work? And can you make accommodations for patients who aren't using a smartphone? And I'll open that one up.
This is Tamara. I can talk a little bit about our experience. So for the contactless check-in, patients with a smartphone could literally click a button. They get a link beforehand. They could click a button to let us know when they arrived to outside in the parking lot. And then we would review to see if all of their paperwork was completed. Once their exam room was ready, the MA could then ping them and they would know that they could enter the facility. So it set up our parking lot like a virtual waiting room at all 30 of our locations. And it can be adapted for patients who do not have a smartphone. It's a little bit more involved and requires the individuals at the front desk really staying on top of it and closely communicating with medical assistants. But we have had a couple instances where some of our older population don't have smartphones, and so they've asked us to call us because they prefer the safety of waiting in their car versus waiting in our reception areas. So it can be adapted, but it works best for patients who do have smartphone available.
Thank you so much. Some important distinctions there. Appreciate that, Tamara. But the next question I'll put out there is, are there any HIPAA concerns around keeping patients' credit card on file?
Yeah, I can take a run at that. The short answer is no. These cards, it's without getting too technical, it's called encryption. They become what's called a token. Anytime a card is stored on file, there's a ton of compliance that goes behind that for the vendor side, our side of the world. So when there is a card on file, and card on file is everyday technology, Home Depot, if you run a transaction, that card is technically stored in their server somewhere. So card on file is extremely secure. There is no risk of HIPAA breaches or any compliance breach whatsoever. And you could always ask your vendor for their certifications. If they don't have them, then maybe do a little more shopping. But most vendors will have their certs for all of the compliance that goes behind card on file.
Thank you for those clarifications there, Brian. The next question I'll throw out from an attendee is, the attendee says, we talk about frictionless and contactless. What were the points of friction that were impacting your business that surprised you?
I'll go ahead and answer that from our perspective at OrthoTexas. One thing that I think was surprising is how labor intensive all of our policies and procedures were. And, you know, it's simple things that you don't think about. We had screening forms that everybody had to sign when they came into the building, and And then there were staff that were tasked with scanning those in and making sure that those got into the right place. It was things as simple as disinfecting our pens. If the patients and the visitors did have to sign something, if they hadn't submitted their electronic paperwork to us, then, we had to clean every single pen, every single clipboard. So we were really trying to encourage that contactless check-in process, but not everybody wanted to participate. So I think just, again, the surprising thing to us was just the labor-intensive task that came into play with all of these procedures.
Yeah, and really adapting to individual patient needs, right? Trying to make it work for everybody. Thank you for jumping on that one, Cindy. The next question I'll put out there, and we're coming close on time, so this may be the last one. We'll see. But the question the attendee asked, for those of you who are focusing more on engaging patients through social media, is there a platform that you feel works best for you?
I'll take a stab at this. Our patients range from 5 to 100, so you have to meet the patient where they're at, and there's a lot of studies on what platform caters to what demographics. And so depending on what you want for your practice, you have to broadcast or network into that group, and whether that is on Facebook or whether that is on one of the new different TikTok-y things that are out there. You have to find out where your audience is that you want to connect with. And it's, again, for us, we had the blessing of bringing someone in-house who was an expert at it. And it has been transformational for our practice, for us to connect and meet our referrals needs when we couldn't go out and really meet face-to-face with people. And it's been nothing short of extraordinary.
Yeah, and just to add to what Tim said, I think it's subjective for every practice what platform works the best. For Colorado Pain Care in particular, the average age of our patients is 55, so we found that we get the most response out of Facebook compared to other platforms like Instagram. So I think you need to look at your patient demographics and then look at similar data that's out there and information that's available on these different social media platforms, and kind of figure out what works best for your practice in particular.
Thank you, Tim and Joe, for weighing in there. I think that'll bring us to a close here. It's such a great place to end on, and it's been a wonderful discussion. I just want to thank Brian, Cindy, Joe, Nick, Tamara, and Tim again for an excellent conversation today. I also want to thank Rectangle Health for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console, and do fill out the post-webinar survey. We appreciate it. Thank you for joining us, and we hope you have a wonderful afternoon.
Thank you.
Thank you.